So, good afternoon all. Welcome you to the Delhi branch of Indian Speech and Hearing Association October webinar. So, I'm here to make one important announcement is kindly fill the feedback form and share with us within 2 days to get the e-certificate of the webinar. The feedback form link will be shared on your registered email ID. And also, please ask your doubts about the topic in the question answer section. We will cover all the questions related to the webinar and also learn as much as you can. So now I would like to call the moderator of the session, Dr. VP Shah sir, to take the charge and introduce our dearest speakers. Over to you, Shah sir.
Thank you, Ravi. Today is the first day of Navratra. It is celebrated all over India. On the occasion of Navratra, I extend good wishes to each and everyone. Namaskar to everyone, our audience, and our two speakers. They are very experienced seniors, professionals. Delhi branch of Indian Speech and Hearing Association. It is a very new and has started many programs. On the line of academic development, Delhi branch of Indian Speech and Hearing Association, in association with our Indian Speech and Hearing Association, has recognized many topics. One of the topic is stuttering. Lots of research, theoretical, practical, many things have been done since more than 50 years about the stuttering. But still it is a ignored subject. There are, as per the WHO, there are many, almost 11 to 12 million people in India suffering from stuttering. Almost 5 to 10% school-going children are suffering from stuttering. And if you see the number of children or people suffering from stammering and number of qualified speech therapists who are eligible to treat the stuttering, very less. So, considering the importance of this topic and particularly for our professionals, a stuttering topic has been chosen today. And there will be two professionals. One of them is Srimati Asha Aggarwal. She is the very senior professional in speech and hearing. She is a founder director of Asha Speech and Hearing Clinic. She is consultant at Sir Gangaram Hospital at New Delhi. She has almost more than 44 years experience, clinical experience in speech and hearing. She is the pioneer in initiating cochlear implant program at Sir Gangaram Hospital since 2001. She has started universal hearing screening program in Delhi. Almost 9 hospitals she has covered, and she has been invited to deliver lecture for our BSLP students where this courses in North India running, particularly in Aliyawarjang. She has been invited so many times. She is also one of the senior faculty to do assessment on behalf of RCI, and she has done 2-3 research program also, like predicting bilirubin-induced auditory toxicity in infants and in utero iron status and auditory neural maturation in neonates. So she will be talking on 10 steps of technical guide for fluency therapy. It will be based on her experience and based on experience of caregiver and client interaction. Second speaker is Dr. B. Rajashekhar. Dr. B. Rajashekhar, everybody in India knows, and junior new coming student to very senior professionals in India. Who doesn't know? He will be, I mean, if he doesn't know anything about speech and hearing, if he doesn't know about it. Professor Rajashekhar, he is the founder and former dean of School of Allied Health Science, Manipal, which is situated in Karnataka. He is the graduate, postgraduate, and doctorate from All India Institute of Speech and Hearing, Mysore. He is the recipient of many international fellowship awards in his credit. He has almost more than 120 publications in index journals and in India and abroad. He has also contributed many chapters in many books, and till date he has guided more than 20 students in India to do PhD program. He is also the member of first ENT specialist, a speech pathologist team inter to have implemented surgical voice restoration by tracheoesophageal puncture Bloom Singer's voice prosthesis for laryngectomies in India. He is only Asian to present a paper at the World Congress on rehabilitation of laryngectomy at London. And he is also the member of team to design and manufacture the first indigenous voice prosthesis for laryngectomy. He is the member of many university like RCI University and many institutes as a board member of studies, BOE, then academic councils and many other things. And Dr. Ratna Award and then Bharat Award he has been given, plus he is visiting clinical fellowship at the Head and Neck Cancer Rehabilitation Institute, Indianapolis, USA. He is also International Cancer Research Technology Transfer Project is involved by International Union Against Cancer, Geneva, to work and conduct a project at Charing Cross Hospital, London. So he is he knows Hindi and many languages. And the more I talk about him, it will be lesser. And he started his childhood education from Agra, and his Hindi, if you talk in Hindi, you will not understand that he is from Karnataka, and he has contributed a lot for the field of speech and hearing. And not only speech and hearing, apart from co-curricular activity, if you see, you will be amazed. And I invite Madam Asha Aggarwal to deliver on 10 steps of technical guide for fluency therapy. Madam Asha Aggarwal.
Thank you very much, Shah sir, for introducing. I want to thank you, organizer of Disha, for giving me opportunity to talk on this platform. And also this topic, 10 fluency therapy program. Well, to my mind, the first question comes that why stammering? In our profession, all my friends may be student or final year, private practitioner, professional, everyone will claim that it's very easy subject, stuttering can be treated very well, and we get immediate results out of it. It is not difficult subject at all. During my life of 40 years, I really thought that is stammering curable? Why should I develop this fluency program? So there were many points which I realized during my tenure of working is that there are many techniques available. Many authors have spoken. Bloodstain, you can follow ventriper, you can follow guitar. All techniques are available. But which technique should be used? Whom, when, and why? Is fluency which they have achieved, is it short term or is it a long term? Usually, are there long term results or lot of relapses? We have also seen that drop off rates are very high in the stuttering therapy. They will have immediate improvement. They will start speaking fluently and they will drop out, and clinician will have no clue how he was performing throughout and outside the world. And they were only comfortable. The case came to me. I have given fluency and case is speaking fine and he has developed fluency. But is that all which we are looking for? Is it curable? then how long the technique should be practiced by them and how long they should be enrolled in our fluency program. So these are all the questions which I started working on over and over again, and I developed this program of 10 steps fluency program. So this gives us a clear cut roadmap that how long this should be sustained for the results almost towards the cure. But what I mean here by cure is fluency not only from speaking but from their mind, from their brain. They have not to think themselves as a they are stutterer, and then that is what I call as a cure. If they have known that no, they are not the stammering, they are not the stutterer, then that is the cure. So we have to take the program till then. So this program designed basically as all other program, and like everybody knows very well. So this my program also depends on the fluent speech, which is an end result of the well coordinated functioning of different systems in body. So all the system in the body are working in a coordination, not only a particular technique or not only a particular system. For beginning with, like breathing system has to be followed regular automatic breathing. It has to be followed by phonation in an easy way. Followed by that is articulation in the mouth where we produce the words. And after producing the word, there has to be auditory feedback through the ear in the brain, like auditory feedback. They have been able to say the word fluently, and then speech planning at the brain level. How long sentence to be spoken, when to wait, and how to construct the length of the sentences, the speed of the speech, all that at the brain level they need to learn. So this is a coordination of all the systems together. Now, how do we achieve all this system working together, having the end result correctly? So the program is designed to handle this fluctuation till the spontaneous conversation, and it is designed for adults who are more than 12 years of age. So I have divided it into the 4 stages. Stage 1 is a developing control of the speech in the clinical setting. So in stage, we are only using all the technique, teaching all the technique. They are mastering all the technique, and they are being able to speak fluently in the clinical situation in front of us. So this includes 7 steps. So all these 7 steps which we will be talking about, what is prolongation, what is phonation, what is soft gliding movement, how to take it at the different stages from phonation to word to small sentences, reading, and then being able to say in narration, and then convert it into conversation, and then take it further. So this first stage is very critical. It is being done in 7 steps. For this period of time, the case will come to you minimum twice a week or maybe thrice a week, and has to be completed in 1 month. This is very important, so that all the steps are incorporated, they carry it over well, and it's a fixed time program, so they know by end of 1 month they will be able to speak fluently, however poor symptoms, however is the severity, and whatever may be the frequency. So stage 1, you and your client is 100% sure that they had been able to speak fluently. Now, as it comes to the stage 2, is transferring this control speech in day-to-day routine and outside the world. Now, what we have seen that these cases in the clinic, they will speak very well. Their caregiver, their family member will say that when they go home, they speak in similar way, the way they were speaking earlier. They are not coordinating all this and transferring these techniques of the rate of voice continuity. So they have 2 speech, one speech for the clinic and one speech is for home. The clinician is happy or is speaking so fluently, but has he been able to carry it over in the different difficult situation at home? That we will come in the stage 3. Stage 2 will be they're very comfortable. It has to be used all the time. They will come and say, okay, when I have a block, then I apply your techniques. But now when I don't have blocks, I don't apply your technique. So that's not the truth. They have to imbibe everything, and they have to develop new controls way of talking in a fluency, and replace the old way of talking. So this transfer is very, very important for them. And in third stage, the monitoring fluctuation themselves in the demanding situation. They should be able to face, they should have so much of confidence that they have what they have learned. Now they can speak in fluently. And in all the situation, they self-monitor, apply the technique and come out of it, because we have worked enough in stage 2. Stage 2 has to go for minimum 1 to 2 months, where we get all their feedback. The WhatsApp chatting is happening, their video we are getting, and we are constantly guiding them. Same is with the monitoring of fluctuation in 3. And 4th is the stage where their self-esteem is really high. They have prepared themselves for relapse. They can talk about their stammering, and they know that nothing can stop them. So these are the 4 stages. If we go through all the 4 stages, I will say that the stuttering for that particular case has been cured. He has come out of that problem. So let's talk about the step 1, which I said is a fluency, developing a fluency. So there are certain guidelines which will go through all the 7 steps. Number 1 is what should be the duration. The duration of the therapy session should be 45 minutes. Why? Because the case is relax their mind. We tell them you are totally relaxed and listen to what you have we are going to do and what we are going to learn. So they put back in their mind all their worries of going back to work and everything. So it is very important to tell them how long the session is going to happen, what are the steps we are going to cover throughout the program in 7 steps, and we need to explain them everything. One thing is very important, that they should not be interrupting with you with the questions in between when you are giving one particular session. Otherwise, you lose what you really want to achieve in that session. The correlation of the session with the earlier session in all the steps should be explained to them very well. After each session, mastering it, learning and asking the questions after the session is over. So the automated reflex has to be developed by them. The target task has to be achieved, and case has to make notes every time what they have understood, what they are going to do, and we review their notes in the next session and explain them, which becomes their guideline for all the time. So now coming to the exact in one session, step 1, what we are going to do in this is that once we have explained them the program of how the fluency program is going to run, so they are comfortable with what they have to do. It's important to tell them what is normal speech production and explain them that why they are having problem, what is a normal speech production and where they are having a problem, showing them their core symptoms. For example, if they have blocked on the bilabial sound, then you literally demonstrate and tell them that how they have given block on the lips, applied the pressure and being not able to release it. So all the core symptoms, if they have problem at the vocal level and if they are getting aphonic, then you need to explain them that how they are making the use of laryngeal muscles, creating the spasm, not being able to take out the voice, and that is why they are getting the block. So all core symptoms should be explained to them with the help of normal speech. What is a normal speech production of all, as we spoke about it, of breathing, articulation, phonation, auditory feedbacks, because these words will be coming again and again. So this is what we will explain them, and then we will start with achieving relaxation. Now relaxation should be totally relaxation from physical point of view, from mental point of view, and developing a normal, natural, automatic breathing. When they are totally relaxed, we know when we are running fast, then our breathing goes haywire. So they have to understand that once they are totally relaxed, then their breathing becomes normal, natural, automatic. And this automatic, normal, natural breathing will be used later on for the speech production and for the phonation. So this achieving the breathing is very important in this first stage, and then we teach them how to take out each vowel. I do not believe in the breathing that take a deep breath and say ah. Take a deep breath and say ah. If you are going to do that, you have to undo all that in normal speech. I rather rely on natural exhalation of the air and producing the voice and producing the vowel and shifting onto each stage. So you will see in this video that how he is totally relaxed, how he is using this phonation, and how he is being able to say each vowel.
अब आप बिल्कुल रिलैक्स हैं और आपका सांस अपने आप चल रहा है। पेट अंदर, हवा बाहर, पेट अंदर, हवा बाहर। 5 बारी बोलेंगे। बस जितना हवा है उतना ही बोलेंगे। आवाज सुनेंगे, आवाज की तरफ गौर करेंगे। बहुत बढ़िया, रिलैक्स करेंगे, सांस ऐसे ही चलता रहेगा और दूसरी वॉवल बोलेंगे। ओ, बहुत अच्छे, 5 बारी बोलेंगे और आराम से बोलेंगे, आवाज सुनेंगे, गले में जोर नहीं लगाएंगे। अब रिलैक्स करेंगे। अब दूसरी वॉवल बोलेंगे हम ए। बहुत अच्छे, बहुत अच्छे, अपनी आवाज सुनेंगे। नेक्स्ट वॉवल करेंगे ई। नेक्स्ट वॉवल बोलेंगे हम ओ। बहुत बढ़िया। आर्यन, आपने महसूस किया कि गले में आवाज नहीं फंस रही है। 1 2 3 4 5 6।
You have seen in step 1 that he has understood how to make use of a normal, natural, automatic breathing, and it is so easy to initiate the voice. So you have totally solved all his problem of a vocabulary level, and then demonstrate to them that speech and articulation, like I literally tell them कि भगवान ने मुंह दिया है बोलने के लिए, मुंह से बोलते हैं नो, हम आवाज से बोलते हैं। Voice has to be changed into the word level. If we have to speak a word and if we keep on saying what is happening? What is happening is that you are not taking out your voice. So if you are saying a word, first it has to be voice initiation and then speaking the word, and that is what is being demonstrated at the word level. So why do we take counting as word level? Because in counting there are 10 words which has same consonant beginning in counting. 20 series will have ta, 40 series will have for, 70 series will have sa. So they will get experience of how to have easy gliding movement, not to hold the articulators, and how to pronounce each consonant. So you are practicing each consonant, and those consonants which are not into the countings, you work on it separately, but give them experience of being able to use articulator fluently with gliding movement, first initiation of voice and then followed by the articulator, and not first saying the word. From their mind it has to go away totally कि मुझे word बोलना है. They have to understand कि पहले आवाज आनी है. So this is how it is achieved at word level. Second step. So we have a video that how this is happening at a word level. I have also explained in it that when he has an issue and the word, then it is changed into shifted into the phrase level. from phrase level to reading to the sentences. So the second step is changing the voice at word level, which you will see here in this video.
43, 44, 45, 46, 47.
अब ये स में आपका जो हार्ड कॉन्टेक्ट हो रहा है उसको सॉफ्ट कॉन्टेक्ट करेंगे, जिप को वहां से हटा देंगे।
71,
दोबारा और हटा, नहीं
71,
सिर्फ से बोलेंगे, मुंह खुला रखें,
से
नहीं बिना दांत पीछे, मुंह खोले,
से
और मुंह खोले,
से
नहीं दोनों दांत के बीच में उंगली रखें,
उंगली
साइड, अब टंग साइड में रखें उंगली को, हाँ अब करो से हलाए टंग को, फिर से हाँ टंग मूव कर रही है ना, हाँ ये मूव कर रही है ना, पहले आप भींच रहे थे, अब बोलो से 71, हाँ अब उंगली हटा लो, हाँ मुंह खोलो और बोलो
71,
हाँ। ठीक, कॉफी आपको ज्यादा प्रॉब्लम आ रही, का 5 बारी बोलेंगे,
का
हाँ
का का
काला,
का
Next, so whenever he has a block, he is learning that how he has to soften his articulator, initiate the voice, and then change at the word level. Once he knows that how to speak each consonants correctly, we want to shift him to the long sentence of utterances. So we are using material. So in reading material, we don't need to prolong in a different long way. It has to be normal, natural, and material should be such that he is familiar with and he can easily transfer it when it goes to narrating situation. Because when you are narrating, you are remembering what you have read and you are saying, but simultaneously you take care of all the techniques again. Exhalation of air, voicing, easy articulator, length of sentence. So that is why it is important that he has to know how long sentence he has to speak. So in the reading material, you put a mark after 4 to 5 words, which has a natural, normal, meaningful. So, he knows through his brain also that so much long sentence he has to speak every time. So he does not fumble in between. He does not make it arrhythmic, very long or very short, or abruptly he does not stop. So this pattern has to develop now through the reading. So reading exercise does not mean we are reading and he is reading fluently, but reading exercise will take you over all the techniques together in being applying and managing it at the brain level. So the therapist needs to model with him. Therapists need to use all intonation pattern, normal intonation pattern without any exaggerated movement, and integrating all the soft contact with auditory breakfast. So here the clinician should practice the same material themselves and being able to speak fluently, guide them and then speak, and then the client will follow. So we will have this demo.
एक लड़का था, उसके विद्यालय का रास्ता रेलवे लाइन के पास से गुजरता था। एक दिन जब वह विद्यालय भालू ने कुछ भी नहीं खाया था।
अब इसको रिपीट करेंगे, भालू ने कुछ भी नहीं खाया था।
भालू ने कुछ भी नहीं खाया था।
कुछ भी, भालू ने
कुछ भी नहीं खाया था।
कुछ वर्ड की सेपरेट प्रैक्टिस करेंगे। मेरी बात सुनिए, कुछ 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 भी नहीं खाया था। कुछ भी नहीं खाया था।
कुछ भी नहीं खाया था।
कुछ भी नहीं खाया था।
कुछ भी नहीं खाया था।
भालू ने कुछ भी नहीं खाया था।
भालू ने
कुछ भी नहीं खाया था।
So we have seen here, before this stage is self-reading, the therapist is sitting throughout the session and making him say afterwards. So one breath therapist is saying, one breath patient is saying. Then you withdraw yourself and he starts reading in each breath himself. So all the parameters are being learned. Now you can give him homework and he can read it himself. You can ask them to send you the video and you can examine and review further. Now one next stage is how to change this reading into the question answer or into the conversation in this or a self-talk. So this video I have not included because there was a limitation of putting only 5 videos. So here I will demonstrate how reading and narrating should shift into conversation or a question answer. So for example, he is reading, मोहन एक बहादुर बालक था, वह कभी किसी से नहीं डरता था. So the moment he will read, मोहन एक बहादुर बालक था, clinician will say, मोहन कैसा बालक था. So it's a Mohan Bahadur Balak tha. So you have given him base to talk. So he gets some confidence that now I can answer the question. वह कभी किसी से नहीं डरता था. वो क्या नहीं करता था? वो किसी से नहीं डरता था. परंतु वह किसी से लड़ता झगड़ता भी नहीं था. वो क्या नहीं करता था? वो लड़ता झगड़ता नहीं था. So clinician is reading. Clinician is making him read the line and the clinician is asking him the question where the same consonant on which he used to have a hard contact and used to get stuck. Now he's been able to say it in a flow. So this is how you are shifting into 4th stage. Your next stage is once he has known and practiced, he's got all the fluency techniques, he has to say it through the brain. So what he has read, he has to remember, apply techniques and then speak through narrating first in the beginning, the stories which you has read and then shift it to episodes. So the old techniques to be used in this session when he himself will talk about his experience. So he is sharing his experience through narrating it.
But again, that feeling is coming that I need to do a lot more challenging work. I am now seeking the options in the USC of Amazon. I have some good options there as well. But now I'm in dual mind whether I should shift or should I stay there.
Today I'll describe you the city of Hyderabad.
Till how much distance he is controlling length of sentence, he is speaking on exhalation of breath. So one breath is allowing him to say 4 to 5 words. There's no need to take extra breath. There's no need to do extra prolongation. It is a normal, natural what we taught him. He has been able to use it into the narration. Here is the second video, which she has totally mastered it and she's using it all the time very normally. The earlier one he was doing in front of us and just learning it more.
It is called the City of Pearls. You can buy some very good traditional jewelries here. Also, the city is famous for its museum and forts. Salarjung Museum is there. Then Charminar is there. Then you can see Ramoji Film City and it takes around 2 days.
So you see the pattern. Charminar is there, Radhaji is there, Hyderabad is Pearls. See, I'm using voice all the time. I'm not using my mouth. And it does not look artificial. It does look natural intonation pattern. So this is most important thing which they should have in their mind. After we are taking them through this and the question answer has been done, reading stage has been done, shift length of the sentences they have mastered, soft context they have mastered, gliding movement they know, voice initiation and auditory feedback they are getting. They are almost through your first stage and they are being able to speak fluently in your clinical situation. So this is a conversation using pre and the post therapy, how he is talking, using all the techniques at the reception area in the clinic. under your supervision, which he has learned, because you have already worked at the brain level. Now his confidence, he knows whatever he's going to talk, he will speak in the same method. So he is no more hesitant. So here is a case after the last step of stage 1.
उसके लिए यहाँ स्पीच थेरेपी के लिए आए थे।
अच्छा,
हाँ,
कितने टाइम से आप कर रहे हैं?
हम तो अभी 1 मंथ हुआ है लगभग।
1 मंथ हुआ है।
हाँ।
अच्छा, तो आपको उसमें लग रहा
फ़ायदा
है कि
हुआ है ना? हाँ,
बेटर लग रहा है पहले से?
हाँ। वरना स्टार्ट में तो मैं बहुत ही ज़्यादा स्टैमरिंग थी। मतलब वो हम अपना नाम भी नहीं पूरा बोल पाते थे कि फिर मतलब मेरा नाम आदत मिश्रा है, पूरा नाम ही नहीं बोल पाते थे। मतलब हर चीज़ में प्रॉब्लम ही प्रॉब्लम थी। फिर यहाँ आए, फिर क्लासें हुई यहाँ, तो क्लास ली।
वैसे क्यों बोल रहे हो?
हाँ, रोका, बहुत बार दिखवाया, मतलब झांसी वो हर जगह दिखवा लिया। दिल्ली तो आते आ रहे 6th क्लास में थे जब आए थे, तो एम्स में दिखवा लिया और भी हॉस्पिटल्स में दिखवा लिया, कुछ होता ही नहीं था। कुछ लोग टैबलेट दे देते थे, कुछ लोग मेडिटेशन करने के लिए बोलते थे और उसको मेडिटेशन भी करते थे और टैबलेट्स भी लेते थे, लेकिन उससे कुछ।
तो आपको क्या पता लगा?
मतलब वो रिलैक्स रहना है और सांस अंदर आहार लेनी है और वो क्या कहते हैं ओवल।
So as you have watched this case, how he was at tree therapy, he had all the 4 symptoms. He could not initiate the voice. He was holding his breath. There was a spasma. He had articulatory fixation. All these were controlled through the coordinated program of each step continuously, and you have seen how he has been able to do it very well. So you are done with stage 1. Your case is very happy. He's practicing and he knows that speech therapy has really helped. Then you are taking him, shifting it to stage 2, which is a maintenance and transferring into all difficult situations. So in stage 2, we can easily apply the learned techniques in the fluent speech, not only in clinical setting, but we under the clinician, they have to go to different places. Like you can take them to nearby hospital, you can take them to shopping mall, you can take him to different stage and be with him and teach them. A lot of practice has been given on telephonic conversation where they just dial any particular electronic gadget and start arguing. So these are all the details which needs to be worked for them to continue. And in stage 3, they themselves should be able to monitor their own fluency. It should not be, sometimes I'm using, sometimes I'm not using, in difficult situation I'm not being able to use. They have to all the time be able to speak only in a fluent one with using all the techniques, even in their house with everybody. All the family members are also being told that they have to speak themselves with him in a similar way. So in this clinician will monitor all his fluctuation. They will maintain an exercises schedule, how often they are practicing. They have to score their or fluency performances throughout the day for their disfluency, and they have to accept that their stuttering is no more a stuttering, but it is a modified way of speaking, which is a normal non-fluency. So this all needs to be imbibed into them. They have to have their own introspection, all the situation, checking the techniques, maintaining their diary, doing the regular exercises, and overcoming each moment of stuttering, and continue the conversation with their self-confidence and staying connected of the clinician with the case is very, very important. So they come out of their shortcomings and they overcome their problems, and otherwise they are not going to come back to you. So you need to be all the time connected with them in this stage 3. And stage 4 will be when they themselves are very confident, they have no fear of stuttering, the assignment of public speakings, group conversation, debating, mock interviews, everything they are comfortable with all the situation, and you need to counsel them about the relapse. So relapse as such is not, they do not have fear of relapse, but being able to speak in a controlled way all throughout in all situations. So this is how we need to control all 4 stages, to which I say will be in more or less like cure of the standing. We do have here those we do have here those who have experienced changes. This is not required. I have said all this. We do have here for interaction who have taken therapy for 6 months or 5 years, and a child also whom interaction will be there. You will have all the questions which will be answered directly by them and for me also. So here I end. My take-home message for you all is that continue to work with them for years. Don't end your therapy immediately after fluency 3 months or 6 months. Prepare them. This is my take-home message for them, and continue to work them, and you will definitely have all-time results with them.
Thank you, ma'am. That was really a really nice presentation, ma'am. We have learned a lot from your demonstration. Now, I would like to request all the client caregivers to kindly unmute yourself. Now we will begin the interaction session. So the first client we have is a student of engineering by profession. He is 19-year-old and taking therapy from past 7 months.
Hello and afternoon to all.
You can unmute yourself.
Hello and afternoon to all. Am I audible?
Yes. So after how many sessions? Yeah, you are audible. After how many sessions did you see difference in your speech?
I think in my case, I experienced a little bit of fluency starting from the 4th to 5th session of my fluency speech program, speech therapy program.
Yes. Okay. How frequently do you practice with the techniques that ma'am had demonstrated?
Yes. Okay. In the beginning,
Yes, you
I
can go
used
ahead.
to practice. Yes. In the starting, I used to practice twice a day, and then after which I achieved certain fluency, I shifted it to once a day, and even after I shifted it to twice in no once in 2 days, and this goes gradually when you experience more and more fluency with the voice.
Thank you. Thank you so much for being here.
Thank you very much.
So the second client is a 3.5 years female child, shows phonemes or syllable repetition at beginning of words. I would like to ask to her mother. Ma'am, please unmute yourself.
Uh, Hello everyone, I am her father. I hope I am audible.
Yes, sir, you are audible. Sir, did you observe change in your child's fluency post the therapy?
Yes, there is a significant change post the therapy, and by practicing different suggestions, our child stuttering has reduced, and now she tries to manage the situation by herself. So she is kind of getting trained in how to come out of that situation.
Are you following the modeling of speech in front of the child?
Yes, yes. We try to model the speech in front of our child to the best we can, and of course, it requires very conscious effort on our part to always keep that in mind while we are talking among ourselves as well. and our child is sitting in front of us, we try to model that kind of a speech which a therapist has suggested us.
Thank you so much, sir. Thanks for being here. And the last interaction of the session is a 30 years old female adult. She had onset from stammering childhood and taking therapy from past 5 years. Ma'am, you can unmute yourself. Yes, you are not audible. Can you unmute yourself?
Yeah, I've unmuted myself. Am I audible now?
Yeah, you are audible. Thank you so much for being here. Did you observe change in your speech post the therapy?
Yeah, so basically, I observed a drastic change in my speech after the therapy. Initially, when I started the therapy, I had stuttering issues. My confidence was quite less. I used to hesitate to talk to people whom I didn't know. I just used to talk to my parents and close friends. Once I had a therapy, I became more confident because my speech improved. So I had the confidence. The embarrassing situations which I used to face, those decreased, and I used to make sure that the other person understands whatever I'm trying to say. So unless and until I have a confirmation from the other person that he has understood what I'm trying to say, I don't change the topic. So that has helped me keep on my points to the other person whom I'm talking.
So are you afraid of relapse and reoccurring of the problem?
I'm not afraid of it. I know it's something which can happen. So you have to check what has changed in your technique due to which it is happening. You have to check that. You have to take steps or take actions so that it does not happen again. And at that point of time, when the relapse or that problem has happened, you have to ensure that you don't get embarrassed. Your confidence should not go down. You have to just ensure that the other person understands what you're saying, and post that in the long term, you can make the changes in your technique as well, so that those relapses don't happen.
True, very true. So what changes have you found in your personality?
Okay. First of all, I feel that people have started trusting me more, because now they know what I'm feeling, what I'm going through, because I can elaborate, I can explain that to the people. So they have started understanding me a bit more and started gaining trust. I feel I'm more confident. I am I am more successful in my professional front as well. And it has made me more happy and stress free.
Thank you so much for your kind interaction. Thank you all for being with us. It was really very nice interaction with all of you guys. So now I would like to call Mr. Jiten Saini, sir, Secretary of Delhi Branch of Indian Speech and Hearing Association.
Hello, am I audible?
Yes, sir, you are audible.
Ma'am, you can mute your video now.
Sure.
So there is something special today. Good afternoon, first of all, to one and all. Today, to make this day even more memorable, we will be launching the vacancy portal of the ISHA, where the job opportunities for speech and hearing professionals from all over Delhi NCR can be posted by the employers. So later, whoever is searching for the jobs, they can directly get in to connect with the people who are offering the jobs. Now I invite one of the most versatile person, Dr. B. Rajashekhar, to inaugurate the vacancy portal. Welcome, sir. You just need to press enter. It will be inaugurated.
Where do you press it now? Where do I press it? Just enter, is it? Hello, can you hear me? Hello, Yeah, can you hear me?
Sir, we can hear you.
Yes, sir.
Yes,
It is done.
yes, sir,
Okay.
we can hear you.
Right. So it's already.
So this is our vacancy portal. You all can go and join the page. You can like that, and you'll be getting the updates. So we wish to hear something from you about this particular portal.
Okay, I just want to offer my hearty congratulations for a real good endeavor from Disha. Because see, it's always we are not really interested in finding jobs for others. We are more interested in our self-development. But I think this is a step, which is different from the other people, where you want to also get placings or postings or positions for your own colleagues. I think that's a real good trend, which I don't think any other ISHA branch has done it in the country. Hats off to the Delhi ISHA branch, Disha, for this wonderful opportunity. So people from Delhi can always look forward to registering themselves, okay, where you will definitely have somebody to find a job for you. Or it's left to you whether to stay on or to move on. But at least you have somebody to hold your hands when you finish your graduation or masters, and then come and then seek a vacancy. So all the best and thanks for the opportunity.
Thank you, sir.
Okay.
Thank you,
And
Ravi.
I think it's a very auspicious occasion as put forth by Dr. VP Sai initially, that today is the starting of the Navratra. So it's a very auspicious season to start with anything. So I think I'm sure that with the blessings of the Shakti or the Devis, I'm sure that this will definitely grow in strength and be a very strong component of the Disha. So all the best, congratulations, and thanks for giving me the opportunity to be a part of this. Okay.
Thank you so much, sir. Thank you, Ravi.
Thank you, sir. So now I will invite Dr. B. Rajashekhar, sir, to have their presentations. Over to you, sir.
Thank you. Okay, now can you all see my slides, please? Yes?
Yes, sir.
Okay. At the outset,
Yes,
I
sir,
wish
clear.
to thank the Delhi branch of the ISHA, or Disha, I would say, for organizing this wonderful webinar and giving me the opportunity and the honor of participation. This webinar has focused on the knowledge gleaned out of over 4 decades of clinical expertise and experience of Mrs. Asha ji, who is the first and the senior most and the most effective speech and hearing professional at Delhi. That's the capital of India. Naturally, she commands a lot of importance over there. And the 10 steps manual, which I was fortunate to go through before it was released, really, it was inspiring, and it struck me as a person who has a passion for not only offering services but also sharing the knowledge that she has accumulated over the past so many years into a manual which can serve as the ready reckoner for any SLP who is dealing with this population of persons with stuttering. In fact, I couldn't find any mistakes. I couldn't make any corrections because it was all written down very clearly, and it was the clarity of the steps for anybody to understand. Was something amazing. And in fact, I mean, when this webinar was organized, I told the Disha people that you must give credit, and she must hog the limelight of this webinar more than me. So I think rightly she deserved the accolades, and she got the first slot to speak about it. And my role is now to touch upon the style stuttering. And in fact, I mean, from after I finished my post graduation, that's 76 to 1999 or 2000, for about 23 years. That is first phase of my professional career. I was also involved in offering clinical services, and I was passionate about voice cases, laryngectomies, and also stuttering. And most of them happen to be the children of my own faculty colleagues or in the campus who used to come with the children and say, my child is, he's having repetitions, having passes. And so many children whom I've advised and told them that it could be a normal non-fluency, just listen to me, I counsel them. They all now become engineers and doctors and officers in the services who come back and say, sir, uncle, you told me that nothing to do about it, forget about it, I'm fine with it. But from 2000, I got into administration, which it takes a lot of your time, and I couldn't really focus much, but I still kept my contact with my clients or the patients, which was of course limited. And I did see many adults with stuttering as well as many children, especially once again from the campus, and my own colleagues are the ones who refer to me. So with that expertise and experience, okay, this talk is going to be a blend of what is my experience with these children with stuttering, and also the recent trends which I have gathered through reading. And now that I have stepped down as the dean, I have a lot of time to really sit and read through. And I must thank my two colleagues for their inputs, which has helped me to prepare this PowerPoint presentation, which I think that you will appreciate, because I've tried to make it as simple as possible. I must thank my student come faculty colleague, Angel, and also one of my student, my very pet student from Delhi, and who is now currently doing a PhD in the area of stuttering, that is Chanchal Chowdhury. I must thank them both for the inputs which has helped me to make these PowerPoint presentations. So I will focus on the child stuttering, giving you the nuances, the basics. And before I start, I think I also wish to recognize the presence of quite a few of my alumni and friends whom I just happened to glean through the list of attendees. I wish to recognize Ruchi Aggarwal, one of my very, very old alumni, and then Meghna Mohan, Dr. Kiran, Chanchal, Carol, Meenakshi. That's in Delhi, you have two Shaktis. One is Asha ji, other one is Meenakshi ji. These are the two people, who have really made our profession proud. Both of them are in the private practice, but, they kept up very high standards, and they really proved that we are a force to reckon with. So I wish to recognize the presence of Meenakshi also. And of course, Neha, then Sonali, which another good friend of mine, and then Varsha Prabhu. And I think most of other people, if I missed out, I'm sorry. But I thought that, it was very nice of you to join this webinar on a weekend, where I think you have better things to do. Amazon Prime has come out with lots of new serials and movies are releasing, but you took your time off to be with us. I am really grateful to all of you. So child stuttering, as you know, is something which, which can be disturbing to the parents. It can also be disturbing to the neighbors, the relatives, because they see a child struggling. Well, that's where you come into the picture. And when you really help this population, I'm sure that, you will really feel gratified that you've done something for the family, the child, the parents, and the relatives. Now, I would divide my presentation into three groups. That is, one is the developmental stuttering, the other one is the acquired neurogenic stuttering, and the third is psychogenic. And all the three groups I have come across myself from the campus and who have been helped. So I thought, that would be some kind of a primer for making you to realize that we have a role in these three groups of stuttering, with dedication, sincerity, and of course, updated knowledge and using certain strategies. I'm sure that you will be able to help the majority of them. Now, developmental stuttering, as you know, is an age-old problem. It's global, it has no boundaries, and it pervades all cultures and races. The onset is usually from the 2nd to the 5th year. The prevalence, especially if you take up the school years, is 1% as per the study in 2008 by Bloodstein and Ratner. And if you look at this, it's very, striking that suddenly, it appears suddenly. The parents come and say, look here, it's perfectly okay till, we had a get together or we had, something happening in the house, a sudden appearance in some children, which is triggered when they try to talk using their just emerging speech and language skills. The child has just begun to speak now. He's using his, his new vocabulary. He's trying to polish his syntax. Suddenly you find that there is some faltering, some repetition, some blocks. So they say that it's come all of a sudden. This is what really usually you see with developmental stuttering. The incidence of which is about 5%. Gender ratio, which is nearly equal at onset, gets tilted more towards the males. The male preponderance of 2.5:1, more males getting affected, more male children getting affected than the females, right? But the encouraging or the most wonderful thing about this 70% of them recover. So spontaneous recovery is about 70%, which I think is a good sign. And also takes off much of our burden. The causes of developmental stuttering, I think all of you know, is something still a mystery. Stuttering itself is an enigma. It's a puzzle to many of us. There have been a plethora of theories, trying to explain why it occurs and why doesn't, why in some people, you get 100%, but in some people it takes time. Why there's a relapse. So all those things, put aside, there's a strong evidence of a genetic basis in stuttering, which is through the recent research. And the most of the stuttering begins from the age of 2 years to 5 years is the crucial period. And that is parallel to many typical stresses of early childhood, which means it's not just specific or isolated. It also stems along with many early childhood stresses, which a normal child will go through. For example, a growth in the vocabulary and syntax, trying to express, lots to express, but limited vocabulary. So all those stresses, come as complementing factors. The causes of developmental stuttering, there are many factors, which could be singly or in combination operating, which could precipitate, which could trigger the stuttering, with, of course, certain predisposition neurophysiologically, or it's a tendency, inborn tendency for the person to stutter. So it's a question of like, the bird sat on the tree and then the fruit fell. So certain factors, singly or in combination, just precipitate it, and then you already have a tendency, or there is a neurophysiological predisposition which takes over, and then it blows on into a problem. Okay, now the environment influence is again very, very relevant. I've seen many times the parents come and say, look here, my son or my daughter is being bullied in the class. There are 2-3 guys there, Bihari guys are. I have nothing against Biharis, Bipisa. I have lots of respect for Biharis. I'm just telling the incidents here. So they said that the 2 Bihari boys are there. They were kind of ragging their son. They used to criticize the speech and say, "Tum kya bol raha tum? What are you talking that way?" So that criticism of the speech was the one which triggered, in one of my clients, stressful events, and then the disfluencies become chronic. That's how it begins, right? So you need to have a very strong mind and a strong heart to be able to brace such environmental situations. And once stuttering starts, it may disappear all of a sudden, or can get gradually worse. I've seen both. Suddenly it goes off, as it came, it went away. But some of them, they got worse. But when it gets worse, the learned reactions from that situation, because when you have a problem, you're going through certain, emotional turmoil, and that sets some reactions of despair, frustrations, anger, whatever it is, those reactions, they play an important role in severity, sustaining it, reducing it, or in enhancing it. Okay, the playmates of school, or even some of the thoughtless adults, right, in a society who are perfectionists, they cause self-consciousness. Tell, why are you talking like this? Look at him, how he talks, how she talks. That comparison makes, the self-conscious. That self-conscious is once again the trigger for them to sustain or to improve. And by teenage, these learned reactions influence the symptoms, and then the whole thing comes off as a condition or a problem which they have to face. Now, because of the learned reactions, they learn to anticipate stuttering. They will anticipate, look, I'm going to now give a talk. I'm going to speak to somebody. I'm going to meet a girl now. I'm going to, talk to my superior or my professor. I'm sorry, a child, of course, a teacher, or maybe the father or uncle who's very strict. And then they start thrashing around in panic. They try to escape situation. They try to avoid it. And by adulthood, the fear as well as the desire to avoid the situation, which can be embarrassing, that becomes a part of the lifestyle. It permeates into the person and becomes the person with stuttering, with certain stuttering characteristics. So developmental stuttering, well, of course, you have, I think this all, I think you read in theory. You have core behaviors, which are the ones which dominate. You have secondary behaviors, which are complementing or which come as a part of the secondary of your core behaviors. The feelings and attitudes, which are very important, which most of us neglect. The feelings and attitudes are also very important. They also have to be taken on a war footing in our therapy. It's an excellent book by Guitar, 2014, Stuttering and Integrated Approach to Its Nature and Treatment. I told you, this book, I got a reference from my student and my faculty colleague, and I really read the book in 2 days. I just could keep it down. It's a wonderful book. I think you all must read it. it gives you an insight into the concept of stuttering in the recent context. The core behaviors, well, right from the time of Van Riper, this our time 1971, right, have been repetitions, prolongations, and blocks. I don't have to explain to you about it. And all core behaviors seem to be involuntary and out of control of the person. And they are different from the secondary behaviors, which are acquired later on as learned reactions to the basic core behavior. So let's differentiate the core behavior from the secondary behavior, which could be present or may not be present in all of them. And repetitions, of course, you know, repeated productions of a unit. It could be part word repetitions, it could be single syllable, or a whole word repetition, not repetition. Okay, usually I find fault with my students for spelling mistakes, but today I'm caught. Anyway, it's repetitions. Then prolongations, of course, the undue persistence of a sound or a syllable, which you know, and blocks, where you have a stoppage of the airflow. There is something which is obstructing the flow. The articulates also might get sometimes, you know, blocked. They go into kind of a fixation. The words can be broken. There could be tense pauses. So all these things, you know, the core behaviors of repetitions and passes, and then blocks. Secondary behaviors are usually escape behaviors, because you know that you do something to escape. Maybe you know that every time I tap my foot, every time I hit my knee, or I blink my eyes, or I, you know, wink at somebody, I get the word out. The escape behaviors. So these behaviors will help the person to terminate the stuttering, and it's done during the moment of stuttering. I put the highlight during because in yellow, because it's the escape behaviors always emanate during the moment of stuttering. At that time, you do something, you nod ahead, or you click, or you do something so that you're able to get out of that things. The avoidance behaviors are something again which are along with the early escape behaviors, where an attempt to prevent, because you anticipate before the moment of stuttering. The other one was during the moment of stuttering, whereas avoidance is, you know that before itself, you want to see how I can get over this. So what do? You substitute, or you say circumlocution. For example, you say, you know, that I want to go to Vasant Kunj in Delhi. So you can't say Va. So what do you say? You know, that place, that flyover is there. From flyover, I have to take a right turn and then come to the place. Something, what is the place? Vasant Kunj. That's how they circumlocate, and then they get over it. So avoidance and escape behaviors. And feelings and attitudes are very important, as I told you that. That's why we have basics of psychology. We need to understand, not just work on the fluency, but also work on the feelings and attitudes, because the feelings can be as much a part of stuttering. It may precipitate a stutter, just as a stutter may create feelings. It's kind of, you know, it's a vicious cycle. The stuttering and the feelings and the stuttering. Initially, the child's positive feelings of excitement are trying to express, but the negative feelings of fear, it may result in repetitive stutters, hardly noticed initially, but then somebody picks up in the family, somebody starts correcting, somebody starts talking about it, somebody starts worrying about it, and then you know what happens. So as the child stutters more frequently, what happens is they get frustrated, they get ashamed because somebody is all the time pointing out, somebody is making fun of it. These feelings make the speaking harder, and with frustration, the shame increasing, the effort, the tension, right, also increases, and that impedes fluent speech. That comes as an impediment, that is a speech impediment, which you call as stuttering. Now, I think we should all now adapt the ICF, you know, the model, you know, all of you know ICF, International Classification of Functioning Disability and Health. If you look at each disorder in the ICF model, I think you get a better perspective, because it talks about the body structure and the body function. It talks about the activity and the participation. It also deals with the personal and environmental factors. So if you look at any disorder, be it stuttering, dysarthria, voice, from the focus of the ICF, right? If you try to, you know, kind of compartmentalize and then study in terms of structure, function, activity, participation, environmental factors, you get a better perspective or a clear perspective of how the patient is going through this. And that will help you also to plan your strategies accordingly. So this is a lovely model of the WHO's model of ICF model, where you start with the presumed etiology of the causes. Then you talk about the impairment in the body function in terms of what you observe as stuttering behaviors, which could be repetitions, prolongations, and blocks. And then you see what are the reactions of the client in terms of affective, behavioral, cognitive reactions, and with environmental factors, feeding in or kind of fanning the conditions, and how it limits the activities, how it restricts the participations. So this is the model which, if you understand, I think it will be better for you even to assess, plan your strategy or plan your interventions. So based on this, if you look at the impairment and body function, so what you should do, you should measure the speech fluency and severity. I'm not going into the test which will help you to measure. You know that if impairment in body function is reflected by your speech fluency and severity being the outcome measures. You do that, and then you have an idea about the body function impairment. Next, you talk about the activity limitations and restrictions in participation. So how do you do this? You see the impact of stuttering on the speaker's life. How has it impacted him? How it has, kind of stopped him from going and attending certain seminars, how it has stopped him from going and attending certain clubs or certain, peer group discussions. So that is the limitations of the activity and restrictions of his participations. Look at his personal and environmental context. Is he able to cope up? Does he have the coping strategies? How does he cope up? How does he react? And what's the negative responses in the environment to his coping strategies? If you have a feedback about this too, then you also get a full picture of what exactly the person is going through. You can put yourself in his shoes, and then you will know what to be done. So in preschool children, the treatment, I would say, is essentially the involvement of the parents, which I think nobody can refute. All of you know that a child, especially, the parent counseling takes the bulk of your time. You spend more time with the parent than the child, in fact, initially telling them about what to do, what not to do, what to look for, how do they set a model for the child, what do they do to improve the child's fluency. And then, of course, you have your child focus strategies. That's very, very important for preschools. Now, the treatment can be an indirect approach or it can be a direct approach. So if it's indirect approach, will be mainly counseling about the changes in speech that you want to be incorporated in the child by the parents, by the family, and also modification in children's environment. If you can advise on that, I think that's something which you can do. That will be an indirect way of addressing the child's problem. Directly, you can work on the child's speech. There are many strategies. I think Dr. Asha ji also told you about the so many techniques that you can do. So you can work on the child's speech. You can also work on the attitudes of communication of the child, which will be a direct approach that you do with the child. Then for school-age children and adolescents, what do? You have to focus your goals on increasing the fluency. That means you must start working on increasing or enhancing the fluency, and at the same time reducing the negative reactions to stuttering of the child from the peer group, from the parents, from the teachers. So if you can do both, not just enhancing fluency, but also trying to address the issue of the negative reactions, well, I think then you can, it's a two-pronged attack, but I think you're more effective than only increasing the fluency. Then strategy, of course, you have fluency shaping strategies like rate control, prolonged syllables, easy onset. That's what you were saying about, the soft contact approach, light articulatory contact. All that can be tried. These are all called the fluency shaping strategies. Then you also have, one is fluency shaping, the other one is called stuttering modifications. When I say modification, I'm trying to reduce the physical tension of the structure. Okay, so how do you modify it? You again have certain techniques, very old techniques, which even I remember Dr. Ratna told me in 1971-72, cancellation, pull out, you stop and then try to cancel it by going over it, sliding and then speaking. Preparatory set, you anticipate the word is going to give you problem, so how do you slowly try to get over it? Pull out, you made a repetition, you made a prolongation, stop, get back to that, and once again do that. So all these things can reduce, they are all stuttering modification strategies, and increasing the speech efficiency and reducing the word avoidance is another thing which you can do in modifications. Now, I just wanted to once again repeat and say how the modification strategies differ from fluency enhance. In stuttering modification, you have a preparatory set, you have the relaxing the stutter, you have the slide, you have the easy stuttering, cancellation. In fluency enhancing, you alter the child's breathing, as was shown in the demo video by Asha ji, the breathing techniques, the speech rate, voice production, articulation. So all these which will facilitate more fluent speech. That's what is called the fluency enhancing strategies. Now, another thing which I wish to emphasize is self-disclosure. You must make the person accept that he has it. Right? He has to accept that he has a problem, but then go on with it. That is once again your counseling or the way that you put across that nobody is perfect. All of us have certain, inadequacy, deficiency. Well, you walk with it and say, look, I have this problem. Revealing the identity as a person with stuttering is one step to face the world. You support, improve the attitudes, boosting the self-confidence, reduce the feelings of isolation. I think all these should form, it should be a kind of a mixture of, strategies which you want to do. You want to really bring about good results. And school-age children and adolescents, well, you have to have strategies for reducing, which have reduced the activity limitation. Look at what has limited that activity, what has restricted the participations. So you must start working on that. You start generalizing the activities. You make sure that you generalize the adolescent or the schoolboy or the schoolgirl is made to take part in school programs, sports day, all that, where you involve them in general activities, and also at school as well as in community, how they can be accommodated. And that's about the developmental stuttering, which forms the bulk of your client load. I just want to make a mention about a few of the children whom I have seen with acquired neurogenic stuttering. So this all of you know is purely neurological disease or damage. The onset is after childhood, acquired conditions. It can also be the first presenting feature of a neurological problem. So you must learn to differentiate developmental stuttering from neurogenic stuttering. Well, of course, you have the technologies, your imaging techniques, which will tell you what's the lesion or where is the problem with it. It's very rare incidence. Men are afflicted more than women. It usually follows a stroke or a head injury or a neurodegenerative diseases. So with the history and then your testings, I think you can definitely you can do something about this. The typical characteristics of the neurogenic stuttering are stuttering on the function and content words, not restricting to the initial syllables, few or no secondary behaviors absolutely, with no fear in them, no anxiety in them, which you have in developmental stuttering. So another one is you also have, I had 2-3 children, who had acquired psychogenic stuttering, mainly because of the stress that they went through. The typical characteristics, they also exhibit core behaviors, repetitions, pauses, prolongations on the blocks, but they also exhibit unusual secondary behaviors, which are independent attempts to produce the words. In developmental stuttering, the secondaries are a part of that because you want to overcome, but here it's independent of the attempt to produce the words. That's one clue for you. And they could have expression of the feelings are accompanied, right? Whenever they want to express the feelings, right, that will increase the fluency. You find them being more fluent when they express the feelings. Okay, that's a sign of psychogenic basis. And you just give them a trial therapy. You take them on for 2-3 days, give assurance and speak to them. They seek attention. You give them all the support. You find dramatic improvement. That again indicates it's psychogenic. But better to find out what has caused it and address the root of the problem. For example, there could be a traumatic event in the child, which I think you need to know from the parents, and then of course use maybe you could approach your clinical psychology, a colleague, a child clinical psychologist who will be able to deal with this kind of a condition so that it doesn't advance into a severe stuttering when it grows up. Okay, so in the case of acquired psychogenic stuttering, well, as you know that it's a conversion symptom, something which is psychological gets converted into physical symptom. A team approach which would include an SLP, a neurologist, a psychiatrist, a clinical psychologist, all of that will have to go through. And I have found the clients whom I have seen, whom I have treated, especially with psychogenic stuttering, not many, maybe some 4 or 5 in my 35 years of my clinical thing. They have really now come out of it thanks to the team approach that we adopted, and not by saying compartmentalizing, living in silos. No, it's a speech problem only. I'll address it. Well, I discussed with other people. And also, you know, the one child had to be given even certain antidepressants because he had tendency of depression also. But I think after that it was weaned away and now the person is perfectly okay. So I just wanted to touch upon these things in a very general way from my limited experience. And I wish to thank Disha for this wonderful opportunity to be a part of you and to share my views on you. I think both Asha ji and me are open for any comments which can be constructive, which can be, you know, destructive. You can comment about our presentation and tell us whether your time was valuable, it was well spent, or it was wasted. And also ask a few questions if you want to share. Thank you. Yes, folks, I think I'm done now. I took 25 minutes. Yes. I'm not hearing anybody.
Thank you so much, sir, for your presentation.
Thank you.
Yes, sir. I think your presentation shows a reflection of a student from bachelor to a doctorate degree. Really, you are very approachable and kind-hearted. I'm getting a memory with you. During past ISHACon 2020, the way you narrated the whole Mahabharata and their characters, truly, you are a Krishna in speech and hearing field. Thanks a lot for being with us.
Kumar Krishna is there, who is the president of the ISHA. He is a real Krishna because he is equipoised. You'll never see him lose his cool. He's all the time same. I'm not Krishna. I'm a mixture of Arjuna, Duryodhana, all the people. Bhishma and all that.
Thank you.
Okay, if there are any questions, I think they can ask.
So here is some questions from.
Okay.
Yes. Yes, sir. Here are some questions from the attendees also. So the child question will be taken by Dr. Rajashekhar, sir, and the adult question will be taken by Asha, ma'am.
Okay, and,
so the
and
first
I also
question,
want to,
sir.
Okay. Sorry, I also want
Yes,
to request you at the end of it, you know, if you can just invite for 2 minutes Chanchal Chowdhury, who is doing her PhD in stuttering. Maybe she can just sum up as to what she is working on, because her doctoral thesis is on stuttering. Maybe she can let the participants know as to what she's working on in stuttering, because that's the latest I think that she's working on. So maybe after the question session is over, if Chanchal is around, I think I saw her name. I don't know whether she has left for lunch or she's around. She left. Okay, that's fine anyway. Okay, so in that case, I think we will answer the questions. Any questions?
Yes, sir. So if a child repeats, yes, sir. If a child repeats parts of words rather than whole words or entire phrase, how we can intervene that? It's a question from the attendees.
No, the thing is, see, you don't see a part word or a full word, isn't it? Because you see, the thing is, the child is struggling and then, you know, is repeating it. Okay, I don't think there's any specific technique for part word and full. You just have to apply your conventional, you know, strategies of relaxing and then, you know, gliding and then maybe speaking with that, right? And then slow down the rate and probably ask them to prolong the thing so that the part word, you know, is taken off as a full word that way. Okay, that's what, you know, usually I am not aware of anything which you have specifically for a part word or a full word. Maybe I think Asha ji will be able to answer this if she has any experience. Yeah, do you have any specific thing for a part word and a full word repetitions in children, Asha ji?
Asha ma'am.
Asha ma'am, yeah.
Unmute yourself.
Her views on you know, a child who has a part word repetition versus a full word repetition. Any specific?
Yeah, so I usually request parents to use that word as a keyword and then start using in a different way, meaning easy gliding movement, and let the child experience that how easily the parents spoke and they could speak, and give child opportunity to say the same word in the next sentence. So the carryover program in a generalized way rather than directly teaching the child, which is for less than 4 years of old children, where I am getting maximum clientage.
Yeah, absolutely right. Okay, you got the answer, whoever asked for it. So you have a general approach, right? Where, you try and see that the child will not avoid the word, but then get opportunity to say the word. Okay. So that I think you'll have to focus on that. Okay. Any other questions for adults?
Yes. So how can we treat relapse or reoccurring of the symptoms?
Come again?
How can we treat relapse or reoccurring of the symptom?
Yeah, relapse or reappearing. I think Asha ji will be able to answer this because I think
in
it happens
pediatric or in adult? In pediatric or in adult?
Ma'am, she's asking for
adults. Adults, relapse. They have recovered. They are recovered completely, but they come back to you after 2-3 years.
Actually, what happens that if you leave the connection with your client, thinking I have gone for 2 years and he is completely all right, or and she, then there is a possibility of relapse. But if you continue to be in touch with them and connect to them every 3 months, every 6, them keep on WhatsApp chatting, then they open up with you and they really tell you that they are facing some problem, and on the core symptom and the relapse, either it is a hard contact issue, or it is a voicing issue, or it is not a coordinated speech, or it is a broken word. So then you judge it and then you guide it through them, and they come out of it very easily because they've already known it. They've just forgotten it and they've not done it. So within 1 or 2 sessions only, you will be able to put them back onto the track, and they come out of it very, very quickly.
Okay.
Do you think person with stuttering should discuss about his problem with others?
Yes, definitely. We empower them. We tell them that helps them to avoid their fear, and they make them very confident. So even to the extent that even if they are in a group discussions or if presentation, they can say, okay, please give me some time. I will like to address this slowly because I have little fluency issues. So that fear will goes away, and they have to accept and they have to say it, and then they become all right. So it's very important that they accept it and they say it, not only to the friend, but even in difficult situation.
Yes, I really endorse what Asha ji said. That's what I think I told in one slide, that they have to accept that they have a problem. Only when they accept it, they get the confidence to face the problem and also to see how they can overcome the problem. So acceptance, I think, yes, we must let them accept it.
Okay. Sir, a last question. For a child who stutters only during a stressful situation and only in conversational speech, will directly moving to conversational during intervention prove more beneficial?
No, see, that's what I was saying. See, first of all, you need to understand what are the situations or what's the emotional, that episode in which, the child has it. So if you understand that, you try to modify the environment. There's one thing you can do. If you can't modify the environment, at least you can modify the way that, the child is able to face it. So here comes the role of the parents, very important. They will have to be told, that at that situation, the parents, the mother or the father will have to be a role model as to how they react in the situation. Which the child looks at it, and then he also gets the confidence. So the parents' role is, I think, very crucial, especially in children, when they have certain emotional, certain situations which are very stressful. The parents must understand those situations and try to remove the stressors as much as they can, and then be able to let the child face it along with them. Any comment from Asha ji about this?
Yes, perfect. I fully agree with sir. He has elaborated in very nice way and covered up everything how to help the child. Yeah.
Yeah.
Thank you so much, sir and ma'am, for your kind answers. I think we are running short of time, so we just move to our next section. So a slok is there. No, न चोरहार्य न च राजहार्य न भ्रात भाज्यवम न च भारकारी भवे कृते वर्धते एवं नित्यम विद्याधनम सर्वधनम प्रधानम. means it cannot be stolen by thieves, nor it can be taken away by the kings. It cannot be divided among the brothers. It does not have a weight. If we spend regularly, it always keeps growing. The wealth of knowledge is most superior wealth of all. Thank you so much, sir and ma'am, for giving us this precious knowledge. No words, number of words are enough to thank you. We are highly obliged to the knowledge you have shared with us. We as a team, thank you for enlightening us on the topic and helping us understand the intervention of fluency management. We can't thank you enough through words. I would like to take an opportunity to thank all the founder members of Delhi branch of Indian Speech and Hearing Association. Thanks for being an exemplary team. I feel honored as I associate myself with you creative people. You all are looking endlessly towards the upgradation of our field. I also feel privileged to thank DISHA Educational and Scientific Research team with this consistently working towards promoting learning in the ESLP community. I thank Dr. Amulya P. Rao ma'am, the coordinator of Indian Speech and Hearing Association, for helping us through the management of the webinar. Last but not the least, I would like to thank all the participants for finding time out of your busy schedule to sit through this lecture, demonstrate your unwavering commitment to our cause. We are most grateful. A special announcement is there. Kindly fill the feedback form and share with us within 2 days to get e-certificate of the webinar. The feedback form link will be shared to your registered email ID. Thank you so much all for joining with us.
Thank you. Okay, I also wish to thank
Thank
Dr.
you,
Amulya, Dr. Amulya, then DISHA,
Yes,
all the office bearers of DISHA, the president of the DISHA, and the movers and shakers of this webinar program, that is Ravi Patel and is it Kalyani? Yes, Kalyani. Okay, for making it possible. Thank you, and then
yes, sir.
thank you for linking the north and the south, Delhi with the south, Asha ji and me together. Thank you so much. It was a wonderful. I never realized that we spent 1.5 hours. It went on so fast, right? I think we need to have more such webinars in the future, so that we are able to share, and we also able to get a feedback from you about what we can do for our clients. Yeah, over to Dr. Asha.
Thank you, Rajashekhar sir. Thank you very much. Thank you for being with us. Ravi, Amulya, Kalyani, and Jitendra, all are very near, dear to me from Delhi branch, and all the special thanks for Rajashekhar sir to join in with us. Thank you very much, sir, taking out the time. I know how busy you are. Thank you very much. Thank you.
Okay, so happy Dasara greetings to everybody. Safe Dasara. May, I think Shakti, may, Devi, Kali, she will trounce this coronavirus at the earliest, so that we are able to move about independently. Let's hope and pray to Shakti, Devi. Okay. Namaskar.
Thank you so much.
Okay, Ravi. So we will leave, right? Okay.
Yes,
we will
Yes,
leave.
sir. Thank you, sir.
Okay. Namaskar, thanks to everybody.
Close the webinar.
Yeah. Okay. Thank you. Close the webinar.
Thank you.
Thank you.